Welcome to Your Dialysis Nurse. If you have been staying up to date with my PD Basics series, then you will know that we last spoke about different membrane types and scenarios in which you use PD solutions. For part 7, we will get into commonly asked questions. Let's start off with, do you need a partner or caregiver to do PD at home? No. Depending on the patient and their comorbidities, you will not need two people to do PD at home. Most units would like it if someone else was trained as a backup for the days you're not feeling well enough to complete dialysis by yourself. But if you don't have anyone to train with you and you're able to complete all tasks independently, then you are discharged to complete PD at home by yourself. Does the process involve blood? Unlike home hemodialysis, the process does not involve blood. You have a catheter that is specially inserted in your abdomen so that you are able to place solution inside to dwell and drain it after a period of time recommended by your doctor and nurse. Is PD easy? I will be honest. At first, it will seem like a lot because you have to learn how to do what nurses are trained to do. But once you learn it, you will see how easy it actually is. Just remember to maintain aseptic and sterile technique and follow the prompts and animated directions on the machine if you're using the Omnia. What is the best machine to use? I really think the Omnia is the best machine to use if you're using Baxter products. It literally talks you all the way through and shows you the steps as well. I'm for whatever makes it easier for the patient. However, I did notice that the Omnia is a little bit more sensitive than older machines, which causes for a little bit more alarms at night. It can be a little annoying for the patient until the machine adapts, but it also helps the provider and nurse understand your membrane a little bit more and address any underlying issues or concerns that may not have been recognized otherwise. Can you travel with PD? Absolutely. You can travel anywhere with PD. You can also have your supplies delivered in the case of an emergency and you travel out of town last minute. Your dialysis company should actually provide a traveling suitcase specifically made for your dialysis machine. We really work hard to make things more convenient for the patient so they can begin to get their life back, which is the whole point of doing home dialysis, right? Will I get an infection? Not necessarily. It depends on how serious you take your care. When you're being trained for PD, we take the necessary steps to make sure we don't cause you to get an infection, and the same care should be followed when you are at home and now in charge of your own care. It's really not hard to keep your hands clean. Proper hand washing should be a common practice, but unfortunately, it's not. Am I allowed to have pets? Absolutely. They just can't go in a room that has your PD machine and supplies. But no one has to know my pet comes in my bedroom when I sleep. Although that may be true, animals are very protective of their owners. They may see the lines attached to your catheter as something to play with or something that may harm you, thus biting or scratching your lines or solution bags while you sleep, introducing bacteria to your body. So please keep all your pets out of the bedroom or wherever you will be performing your PD for your safety. Thanks again for stopping by Your Dialysis Nurse. If you like the content, please like the video and subscribe to my channel. Also, check out yourdialysisnurse.com. I am there to help you guys, and we now have a forum. Please check out the forum if you have any questions pertaining to dialysis, to the kidney transplant list. If you have any suggestions, sign up for free and comment for free. Thanks again.